discussion, which is designed to keep our community informed on the impact of COVID-19 and your local options in terms of vaccinations and testing. And today I am joined by some wonderful professionals here who are going to help lead our discussion on topics to help you mitigate efforts to end the COVID-19 pandemic. So let's talk about a few of the topics that we're going to discuss today. Access and equity around vaccine availability. That's been a hot topic in our community lately. Facts and myths about vaccinations. How to talk to your friends and your family about COVID-19 and the vaccine. And how do we continue to safely operate in a partially vaccinated world? So now let's get right to it. I'm going to go to the expert panelists that we have here this evening. I'm going to ask each panelist to introduce yourself, tell us what you do and why you do it. And let's start here to my left with Nurse Carla Brown.
Hello and good evening to everyone. My name is Carla Brown, registered nurse. I am a hospice nurse by day, a crusader in the afternoon and on the weekend.
Hello, everybody. I'm Byron Jasper. I am the founder and CEO of Byja Clinic, Louisiana's first and only Black-owned direct primary care practice, and also the founder, national president, and executive director of Comprehensive Medical Mentoring Program, a nonprofit organization that is founded to get more minorities into the medical field.
I am Nicole Thomas. I am a doctorally prepared registered nurse of 16 years. I am also the CEO and founder of Impact Nurse Consulting, where I help healthcare organizations to really and truly understand the deliverables that are needed for quality delivery of healthcare to all of their patients.
Hello, my name is Courtney Scott, Assistant Chief Administrative Officer in Mayor Broome's office, but I also am a community curator and a person that advocates for people that don't feel like they have a voice.
Hi, good evening. My name is Raegan Carter. I'm the Director of Health Policy and Governmental Affairs with the Louisiana Primary Care Association.
Well, thank you all for being with us, and I know you will have some insightful information as we continue our conversation. Now, today's questions were actually emailed to us by local residents in our community. And if you would like to contribute to further discussions that we may have, make sure you email us at healthybr@brla.gov. That's healthybr@brla.gov. Now, before we get to the questions, I'd like to get the conversation started with a few questions of my own before we get to the residents' questions. And let's start with Dr. Jasper. Dr. Jasper, could you please explain to us how the vaccine evolved from a medical perspective, and about the timing of how it was produced that sometimes causes or contributes to some of the myths in our community?
Yes, ma'am. So I think a lot of people aren't aware that the vaccine development actually didn't start with the coronavirus. It actually has been something in development for almost 6 or 7 years when you're talking about the specific technology that goes into a lot of the viruses that have been produced. To put it in a better perspective, a lot of people don't realize that the development of the vaccine technology started with things like SARS before, Ebola before, Zika before. These practices are actually been studied for years and years and years, and then it just so happened that the coronavirus shows up and we've already been practicing. And by us practicing on these other viruses using similar technology, we were able to, in essence, get lucky, but also be very prepared at the same time. So it isn't really an overnight sensation as a lot of people think it is. They think, oh, well, the virus started in March of 2020. Vaccine happened in a few months. It actually has been in development in a lot of different ways, a lot of different countries, and in a lot of different efforts. So that's the first thing I always like to highlight. The other part is that a lot of the actual different vaccines that came to be, that were approved, have actually had a lot of research that happened for them to be approved. So to be a little more specific, Pfizer, I believe, had about 42 or 43,000 people in multiple trials that they actually studied the vaccine in. And it was obviously a lot faster than the traditional, but that happened also because there were a lot of funding that was put into this vaccine to find an actual vaccine. Same thing for Moderna, same thing for Johnson & Johnson. I believe Moderna had about 30,000 people in their vaccine trial. And I believe Johnson & Johnson, I'm not sure if it was 10,000 or so, but they have definitely done studies on in different countries on different continents. So a lot of the information that a lot of people miss is thought in America and America only, and they miss the idea that this is a global effort, a lot of funding from a lot of sources, and a lot of technology that has been in development for years and years and years. And as that development happened, coronavirus came, and basically we were well prepared, whether people knew it or not.
You know, I'm glad you shared that. Interestingly enough, I want to say it was last year, not long after the virus emerged here in East Baton Rouge Parish, that I met someone who told me he was in a trial
Yes.
for the vaccine, and that he had a certain condition, so he met certain criteria that they were looking for people in the trial. So it certainly confirms what you're saying, that this has been going on long before now. They just didn't say presto changeo, here's the vaccine.
Absolutely.
But thousands of people were tested.
Yeah, almost hundreds of thousands actually, and that's well before we got to actual approval. So a lot of people don't realize that, again, if you have 100,000 people being vaccinated and tested, that's really important before you actually approve the layperson to get an actual vaccine. So that's pretty impressive to say it was done in a few months. And again, that's something that technically doesn't happen on a lot of different vaccine trials.
Thank you for
Yes,
that
ma'am.
information. Raegan, I want to talk about the Louisiana Primary Care Association. I've known about that organization for quite some time, and I believe that part of their mission, and you share a little bit about their mission, is certainly to connect with underserved communities.
Absolutely.
And so what role is the Primary Care Association playing now as we talk about health equity against the backdrop of the vaccines?
Absolutely. So the Louisiana Primary Care Association, and a lot of people see us in writing as LPCA, we are the membership organization or the trade organization for all of the federally qualified health centers in Louisiana. And with that, we have 39 organizations that operate over 300 FQHCs, as well as about 100 school-based health centers. And so with that, our organization provides technical assistance and training to those organizations that have those health centers. And so we are always focused on equity. Even before the COVID-19 pandemic, we were all about making sure that communities had access to health care through preventive services, dental services, primary care services, and women's health services. And so at the beginning of the pandemic, we were a part of the COVID-19 testing. And now with the vaccines, we actually had some of our health centers to stay open around Christmas time to take on deliveries of the vaccines to make sure that they were able to administer those vaccines to their patients. And so we're playing a huge role. We're constantly looking at data on who is receiving the vaccine in communities. We're working with several organizations, as well as, of course, working with the state and the federal government, looking at that equity issue, making sure that people who want the vaccine, first of all, can achieve and obtain the vaccine. And we're also working on, we hear a lot about vaccine hesitancy, about people, you know, being afraid. And so we're also working on changing that language a little bit and talking more about COVID-19 confidence, making sure
like
that
that.
people have confidence in us as the community provider so they can know that we are up to date on the research, we're up to date on what needs to happen, making sure that they can come to us and ask questions, because hesitancy sounds a little bit like we're putting the responsibility on the patient. And the responsibility should be on us as the healthcare providers to make sure that we're, number one, answering questions. We're there in the community, and we're open to be able to make sure that we're able to administer the vaccine.
I love that. COVID-19 confidence.
Yes, yes.
I like that transition.
Yeah.
And you're absolutely right. That's what we're trying to do right here, is to answer questions that people,
Absolutely.
and to build the confidence with accurate information, not rumors, not
Right.
myths,
Right.
but data and factual information.
Yes.
Now, I heard, and I think you all may have heard this recently too, President Biden in his recent speech talked about a target date of
Yes.
May 1st, with people being able to access, everybody
Yeah.
being able to access the vaccine. So what role will Louisiana Primary Care Association play in that in terms of capacity for our community?
So we recently released our annual report, and I think that this data is extremely important to know how much we're available to the community. Last year, we served over 400,000 patients, and they had about 1 million visits, and that's just with 300 clinics in our state. And we actually have about 28 to 30 clinics in the East Baton Rouge Parish area, and that also includes the school-based health centers. And so with President Biden announcing that May 1st date, of course, it's extremely exciting because we have people who want to get the vaccine. And so what we've already been doing, and we're working with organizations to expand, is many of our health clinics have started to stay open on Saturday. Many were already open on Saturdays, but lots have extended those hours and are now open on Saturdays. And many of our health centers are also hosting community events where they're out in the community, they're partnering with churches. Some of our health centers are also doing drive-through vaccines events where you schedule your appointment, you drive through, you get your vaccine, you wait in your car for that waiting period. And so very innovative in terms of making sure that the vaccine is accessible. One of our health centers, Southeast and Zachary, recently did a huge event at the Zachary Youth Park. And we heard that they vaccinated about 300 people during that time. And so really making sure that we're there and we are available to make sure that people who work different hours can come, make sure if I want to bring my entire family, and my entire family is able to receive the vaccine. So we're looking to expand those operations and do whatever we need to do, partner with different organizations, partner with your office to make sure that that happens.
That's a great report, and it makes me excited to know that this access is going to be increased. Now I'm going to turn here to my immediate left to someone who has now become, would I say a celebrity? You feel like a celebrity, Nurse Brown? Well, let me just tell you, you are a celebrity. And but I know that your heart is in your service. Mm-hmm. But I, want to thank you once again for what you have been doing. Everybody may not know your story, Nurse Brown, in terms of the work that you're doing to make sure that people access the vaccine. So tell us about your work and the motivation behind your work.
Well, the motivation came, as you heard before. As a nurse, I was the one responsible for bringing the COVID to my family. My household consists of myself, my deceased husband, my dad, who is 90-year-old, my brother, who is 67, but had lots of comorbidities. They all were hospitalized. I was able to stay home for the 3.5 weeks by myself and just care for myself. But my husband was one that did not survive. He beat the COVID as he did the cancer of the liver, the bone marrow cancer. He was shot in the head at a very young age by his ex-brother-in-law who killed his sister. And this man went to work every day. You never could tell he had any problem with cancer. And so it was a deep hurt for me when I brought the virus home. So yes, it's a personal motivation, because when I looked at the data one day at my job, I'm a hospice nurse for Cannon, and I seen such disparity. We have the lowest rate for Black people in the undeserved areas. And I'm like, all of the vaccine and the accessibilities, and I'm grateful, but they still wasn't reaching these people. Mm-hmm. As a hospice nurse, you go to serve a resident, but you see the need. They did not know how to assess the cell phone. They're not computer savvy. Mm-hmm. And I know personally, because I went to do it. Mm. Each time you go to a drugstore, well, you go on our website and it'll direct you to how to register. Most of our people that I'm trying to reach have government phones, meaning that minutes are limited. Mm-hmm. And I'm like, no, we have to fix this. Mm-hmm. So that's what drove me to become that crusader. I will knock on your door, help you register. And since we were able, I'm so happy to report, to team up with Mayor Broome We are now so close within a few days to having the vaccine that I can help families at a time to receive this vaccine. I want to see the numbers come up. That's how we can open up Baton Rouge, is getting everybody who wants the vaccine to have it so we don't have to go back. Critical nurses need the break. And every time we celebrate holidays and have these large gatherings, we are straining the critical care team in the hospital. And they deserve to have time to go and spend with their families. But until we get them vaccine and educate, it won't happen.
Wow, you said a lot. What you said was very powerful. You know, Nurse Brown, in your comments, you talked about one of the barriers, and that barrier was the fact that people have to go through this lengthy process to register. And maybe while they're using technology, some folks have limited technology because of the minutes and the priorities. Tell me, what other barriers or obstacles have you noticed that need to be removed as we improve access?
The second barrier, I would say, is accessibility with transportation. And then the safe when they leave their home. A lot of them want the vaccine, Mayor, but they're afraid to leave their home. So if we can have them, and then a lot of them cannot write. So you asking them to fill out a form, and a lot of these medical terms on that form, they cannot understand. But if you read it to them and break it down in their language, they understand the questions. So it's about education, filling out the form, having accessibility through transportation, or as we're trying to do now, bring it to them.
Well, you know, I think a number of people noticed that this week now we're moving towards bringing the vaccine to people, the homebound, especially our seniors, with a partnership with the Council on Aging, so that's a good thing. Now I have some more good news for you.
Okay.
You know, I think you bring good news. Guess what? We are going now to remove a lot of the obstacle and barrier about transportation, because guess who's getting ready to partner with us to pick people up to take them to get the vaccine? Have you heard of a company called Uber?
Wow. Are you serious?
I'm very serious. We're going to make a big announcement next week.
Oh, my God.
So
That's
Uber
amazing.
is going to partner with us, and they are going to go pick people up
That's awesome.
and take them to the vaccination sites.
That's
That's
amazing.
awesome.
great.
That's great, isn't it?
Yeah.
Innovative, innovative.
Yes.
Yeah.
Networking.
Yes.
So I'm excited about that.
Yeah.
And I thank you so much for your work. Courtney Scott, you're all over the place. You know, I love that you said you're a community curator.
Yes,
Is that
ma'am.
I'm not going to ask you to define that. I think I know what that is. It means that you're all over the place. So as someone who works closely with the community, what suggestions do you have to offer our community for staying safe?
You know, Mayor, one of the things that you stress to us as not only a staff, but as people that you care about that work with you every day, is that we have to carry ourselves in the way that we want to be the example. And I think that that's something that everyone has to understand. You know, there are people like Nurse Brown that go to work every single day to sacrifice her life, and we have to consider that as residents and as people. And I'll say that in my age demographic, little past millennial, but still have a desire to hang out and do things, we have to make conscious decisions. And I think, you know, what I would share with my friends and folks that are watching this is that we have to keep that bubble. We have to go get vaccinated, and we still have to go get tested. That's the biggest part about it. I think that people think the solution's coming, we're done, and we're not. We have to stay educated. to get the understanding of what is happening, what we should do, and if you are going to choose to live an at-risk lifestyle, and that's a word that I have to use because people don't want to consider going to a bar, eating out with friends, and doing things an at-risk lifestyle. But if you're still connecting with people that are outside of your household in a COVID-19 culture, it is at risk. So I would say that if you're going to live that at-risk lifestyle, you should get vaccinated. You shouldn't be afraid of it. You have to get it. You do have to continue to get tested, and also staying educated to all of the things that are happening with COVID-19. CDC, trusted websites, and as much as we like to get information from family and friends, you have to check your resources, and as Nicole always says, get receipts for the information, which means that you know that it's coming from a valid source. The information is there. It is our obligation to get it, and I'll close with this. We have to make sure that we're protecting ourselves and our family, because someone like Nurse Brown, her job and her work had her bring COVID to her home. We cannot be irresponsible and just do it just because. You know, everybody's at stake.
Thank you. Now, Nicole, you're a nurse also, aren't you? Yeah. So I got two nurses, Nurse Nicole and Nurse Brown here. Nicole, you know, I had a conversation, and I have a lot of conversations with people, but I have had conversations with some family members. And I remember early on, Dr. Jasper, that when I was having these conversations, it was right at the start, if you will, of vaccines, and they were just coming out. And you talk about some apprehension that people had just when they were just coming out. And a lot of people were saying, Raegan, they were like, I had some family members, I'm going to wait for a little while. I'm not going to get mine right away. And so, you know, you start to think about that, and you have those conversations. And then one day I had one of these aha moments about, as soon as I can get this back, I told one of my cousins, I said, you know what? I am now fully persuaded, and as soon as I can get that vaccine, I'm going to get it. And ironically enough, my cousin got hers before I did. But I bring that out because these conversations that we have with family and friends, Nurse Brown, they're weighty,
Yes.
and they influence. And so I just want you, Nicole, to talk about the value and importance of these conversations that we have with our friends and our family.
Yeah, so for me, it's about not talking to them, but talking with them. And what I mean by that is, number one, I always, you know, when I need to have these conversations, I just ask them, just come to me with an open mind. I know you've heard a lot, I know you've seen a lot, I'm just asking for an open mind. And so the next step in that for me is really and truly acknowledging how they feel about it. I want to validate your concerns. I want to validate your, you know, your fears about it, and let you know that that's okay for you to have that, right? That's the part of me talking with them. And the other part of that for me, like Courtney said, is the receipts, right? And what I mean by that is really and truly providing them the information with the receipts, but on a level, like Nurse Brown said, that they can understand. Because there's so much information out there when they start talking about mRNA versus DNA and all of these different things, my family and friends, they're not going to, what is that, right? And so I have to find a way, creative ways a lot of times, to really and truly break it down on levels that they can understand. You know, whether that means I need to bring in some music to relate it to, or whatever it is I have to do, right? So I think that, you know, when having these conversations, we need to make sure that, number one, their feelings are validated, that we're asking them just for an open mind. And, you know, I always tell people, at the end of the day, it is your decision. And I don't want you to do anything that you're not comfortable with. But just have this open mind and just think about the facts, the evidence-based facts, or AKA the receipts that are here for that. So, you know, in those conversations, I think it's just important for us to continue to talk with them and not at them.
Thank you for that wise counsel. Appreciate it. Now let's see. We do have a few questions from the audience. Mike M. asks, almost everything we hear about the vaccines are positive reports, and that there are virtually no negatives. There must be some downsides to the vaccine. Could you tell us some of the reasons not to get vaccinated so we can make fully informed decisions about whether we want them or not? Well, that's kind of a tough question. Who wants to take that on, Dr. Jasper?
I had a feeling that was going to come my way. So I'll say very candidly, nothing in life is 100%.
Right.
Nothing in medicine is 100%. So there are going to be things that aren't quite perfect. But those things, from what I've seen, what I've read, and what I've had in my patient population, are very minimal at best. Arm soreness at the injection site, cold-like symptoms, so fever, chills. Some people may have some coughing, shortness of breath. A lot of people have headaches and fatigue. But those are minimal compared to the actual virus.
right.
And I think what happens with a lot of people who are vaccine weary or nervous about vaccines, or whatever term you want to come up with, they are usually trying to find a reason to talk themselves out of it to validate why they don't do something.
Yeah.
And those are the people that are tough to convince, and honestly, you may have a lot of work to convince them versus just saying, look, when you're comfortable or you want to have an open conversation, let's do that. But the patients that I usually have a lot of success with that are on the fence are those that are realizing that, look, I have a lot of family members that I love and I care about, and I want to make sure that I take care of myself to take care of those people, because a lot of the patients, I often tell them, it's amazing how you take care of everybody else,
Yeah.
but you don't take care of yourself. So how is it going to flow if you're not around and everybody else has to now take care of themselves? And all of a sudden they say, well, I never thought about it like that.
Yeah.
I never thought about taking care of me and vaccinating myself to protect everybody else. I'm thinking about it just for me. And as you start to, again, relate to them and break things down to them in a way that they receive it a little bit differently than what you see on TV or in the newspaper, people start to listen a little bit differently. And a lot of the patients, at least mine, they know I'm very authentic is the word I like to go with. So I speak clearly, I'm direct, and I tell them exactly what I believe they need to hear, not what they want to hear. And as that happens, that relationship is built. A lot more people are trusting of me as a physician, which I really appreciate. And I think that means a huge amount to someone like that who is asking that question. If they were in my office, in my exam room, and we've had a relationship as doctor-patient for 5 or 6 years, a lot of that conversation may be a lot differently compared to, well, I really don't have a primary care physician or a primary care provider. So at this point, I'm just basically going off of what I hear. So having those barriers broken down by having those relationships, having those authentic conversations, being knowledgeable about what you're speaking on and what you're actually doing actually makes a difference when it comes to this type of vaccine.
Yeah.
Mary W. asks, why is it so urgent to vaccinate everyone and do it so quickly? It seems like this is a rapid effort for a disease that only affects a limited selection of the population. Who wants to take that? I'm not going to throw everything at you, Dr. Jasper. We've got some
I stay doing it, so I'm used to it, but it's okay.
Yeah, I would say to that, you know, the urgency, and I'm going to be very honest and transparent here, the urgency is life and death. That's the urgency. You know, we're talking about a disease that is not just in Louisiana, it's not just in Baton Rouge, it's not just in the United States, it's global. And so it's impacted so many people on so many different levels. We have to mitigate this now. If it's not mitigated right now, we are going to be headed for even further destruction. So, you know, the urgency that Mary M. is inquiring about, she's absolutely right. It's there. And that reason for that urgency is it's life and it's death. And we have to find ways to mitigate this right now. And I really think that, you know, as we continue to move forward, she's going to see even more urgency, right? As we see new things come out, you know, there's talks of new strands and things of that nature. So it's just critical for us to continue that urgency and not let down off of it at any point. So that will be my response to her on that.
You know, there was another part of her question that contained something that really concerned me. And it is that she says, it seems like this is a rapid effort for a disease that only affects a limited selection of the population.
Well, I would like to speak to you personally. It affects everyone. Rich, poor, regardless of your race or creed. I want you to listen to our heart. And please set aside any negative data you may have received. In order to be successful, I would love for you to become one of our campaign chairs that will help educate other people. It's people like you we really need right now.
Yeah.
To go to their neighbors and say, hey, I get it. No, it do not affect just a few. It don't just affect the African American culture. It affect every race, status quo. Our former president, who had the best of care, was diagnosed with this COVID. So what about you and I? That's on a natural playing field.
That's right.
Yes, it's an urgency. I feel that if we can get the majority of the American vaccinated, you will not have to have a plate turned upside down when holidays come. You will be there to celebrate that grandchild taking his first step or that daughter wedding. Please understand, it's not just affecting a few. I hope that somehow, some way, this panel today is giving you true information. And I would encourage you, go and research the data that we're giving you. You will see this is not just words. This is true factual data. You have truth or you have lies. We are trying to present and educate everyone on the sound of our voice. Listen to the science, listen to the data. But most of all, listen to your loved ones who will not get the chance to see you around for the next holidays.
Well said.
Yes.
Richard C. asks, on the news, the national experts are providing conflicting information like, it doesn't matter if you get your 2 shots from 2 different manufacturers. They've also recommended administering half doses to get more people vaccinated. Can the panelists address the inconsistency in the messaging about the vaccines and the decision-making regarding them? The race to the vaccine increases doubt and distrust. Can you help us know what information is correct? This is some things I haven't heard about, but maybe some of you all have.
I'll kind of jump in a way to say that there was conversation at one point in time about mixing vaccine doses, whether it was the first dose was a Pfizer and the second dose was a Moderna. But the indication for that was if you had no alternatives of receiving the same vaccine from the same manufacturer. So basically the idea is, look, if we can't give the consistent vaccine from Pfizer number 1 to Pfizer number 2, Moderna number 1 to Moderna number 2, then it may be okay to mix them. But it wasn't the you should do that.
Right.
It was if we don't have any options. If we had a vaccine shortage and you only had one left over, then it's probably okay to do that because it's better than nothing. So that was probably where that beginning of that question came from, where at one point it was, we may not have enough vaccines for enough people, so if that's the case, you can mix. But outside of that, the idea is to stay within the same vaccine manufacturer. There are more vaccines being made at a higher rate now, so
Right.
more vaccine availability is there, so there shouldn't be a need to mix anything. And of course, we now have Johnson & Johnson that's been put out, which is a one-shot vaccine, so no need to mix there either. So I think a lot of that has started to shift, and the more that we get further into manufacturing more vaccines, we won't have to even consider the mixing question.
Right.
And let me add this and ask you to offer some clarification, because one of the myths is that, well, if Johnson & Johnson is just doing 1 shot, why are some of the others doing 2 shots? Is one better than the other? I know, not that I have heard.
And again, it's not a one-size-fits-all question. It's not a one-size-fits-all answer. So to try to go into detail without boring everyone, which medicine can do that sometimes, the idea is that certain vaccines have been studied that when they give the first dose, it proves that there is some effect. but they need a second dose, in essence, a booster, to achieve a higher effect. Whereas some vaccines only need one dose to achieve the effect that they were looking for. So Johnson & Johnson may not be as effective as the Pfizer and Moderna when it comes to efficacy, one of those big medical words that means it works. But it is effective in the overall rate of basically lowering deaths and hospitalizations. So the idea to get to folks that are like, well, why would I go with Johnson & Johnson if I can get Pfizer? And they're starting to nitpick on which one I should get. I say get one.
That's right.
And the idea is it's better than nothing. The alternative is we may get sick. We may have family members that are no longer with us. We may have people that are often affected who we may never even meet, but it's one of those things where you may have to carry the burden that you could have done better.
Right.
And I'm often trying to encourage folks that I don't want to wait to hear from you when you're sick. I want you to talk to me beforehand, and if we can get the vaccines into more arms and eliminate the idea that there's this, which one, should I do this, should I do that, and just have people start getting vaccinated, I think a lot of the misnomers and the miscommunications will change.
Yeah.
So this has been a very meaningful, insightful conversation. Now, as we close, I'm going to ask you all this question, what I often get asked by reporters as we're concluding an interview. They always say, is there anything you want to add? Is there anything else you want to say? So we'll just go around. Raegan, is there anything you want to add before we close?
Thank you so much. That's the first thing. Thank you so much for putting this together. This
Yeah.
has been amazing, and I think that our Baton Rouge community needed to hear it. And of course, all I would have to say is if you need an FQHC, reach out to your community health center, and we are absolutely there for you, and we'll absolutely get you an appointment.
Thank you. Courtney?
The one thing that I do want to add is for the questions of what's the urgency, outside of just medical, I have the humble privilege of serving in community development, where we have seen the impacts of COVID step outside of just the medical arena, where you have people who are jobless.
That's right.
You have people who have had to separate households because the person that is the primary household person is very vulnerable, and the younger person in the house has to go to work. So now you have people that are essentially homeless or people who cannot pay their rent. So there are so many impacts from your local business that may have had to close, your young person that cannot go to work. People are not in schools, which means the education levels are, there's a variety of changes in education levels with our youth who are not used to learning in an environment where they're just digital. Mothers have had to take off from work to be at home with the child to make sure that they're there. So the impacts reign outside of just health. Health is primary, it is the most important, but it is impacting everyone of every color, shade, and gender in our community and across the world. So the impacts are there, and that's the urgency.
Nurse Nicole?
I would leave everyone with just open your mind to the vaccine. You know, I know that there's a lot of doubt and a lot of question some people may still have, and that's okay, but just go in and get the information from credible evidence-based sources. The CDC has been doing an amazing job of putting consistent evidence-based information out there that everyone can understand regardless of your educational level, right? So, you know, just try to, you know, not really go to Facebook for all of your information that you may need, and let's go to some credible sources. And so I think that will definitely help you get the answers that you need to make the best decision for yourself.
Dr. Jasper?
So much, as others have echoed. So first and foremost, thank you for putting this together. I think one of the things I often tell people when it comes to reaching a lot of the disenfranchised folks within the medical system is to think outside of the box. Don't always think that folks have to go into the emergency rooms and the primary care clinics to often get their information. So doing stuff on different platforms is very helpful and also groundbreaking in my opinion. The information I would leave folks with in this session is that I'm a primary care physician. And by training, a lot of my care and my actual advice comes in the form of wellness and speaking about healthcare prior to sickness, prior to illness. So the thing I often try to engage different people on a topic level is to say very plainly, get into care before something happens. A lot of the people that are minorities are often waiting until they're sick for a number of reasons. They don't have insurance, or they're not able to afford care, or they don't know when to go to care. They're taught that they need to go to the doctor when they're sick, not when they're healthy. All of these things happen, and that's where healthcare disparities start.
Yeah.
It starts because people are waiting until they're ill to start accessing the system. So being a primary care physician, one of the biggest things I mention is to often say very plainly, get into care early. If you have a primary care physician who speaks your language, meets with you on that playing field, answers your questions, and is authentic, you often have a lot better success, and those healthcare disparities go away. And I know a lot of my patients know whenever we have conversations, they're going to hear from me about health on a number of levels: financial health, mental health, emotional health, physical health. And that conversation is important. So when something like this happens, when the phone rings and people call me or I see them in my office, the first thing they say is, I didn't want to do the vaccine until I talked to you first. And that means the world to me, because it tells me that I did something right,
Yeah.
that they're picking up the phone, they're making their appointments to make sure that the care is delivered in the way it should. And then these gaps, these healthcare disparities won't be as vast.
Right.
And finally, Nurse Brown.
Again, to say thank you for allowing me to have part of this discussion. I'm so honored. But we have to recognize in the medical field that our paradigm has shifted.
Yeah.
We have been so used of best practice, preventative care. Now we have to focus every fiber of our being now to shift to control.
Yeah.
And normally that would be in our third step of the process. But now it is number one, control this virus. It would take all of us to do this. So let's tag team. You want to be back in your place of worship. I know pastors are waiting, but in order to do it safely, we have to get you vaccinated. I cannot stress that enough. In order to have some type of familyship, you need the vaccine. Take the vaccine. And I think we can move forward from there. But now we're at a place of control. So that's okay. The paradigm has shifted. We shift with the paradigm. But we will achieve this goal.
All right.
God bless America.
I think that's a great way to end our conversation tonight. We will win. We will win
right.
as we work together. And so I want to thank all of you all of our panelists for participating in COVID Tales BR. And I want to thank our audience for tuning in. I know that you've received some valuable information, and now I need you to act, to practically apply this information that you've received and act. Get tested and get your vaccine. Thank you so much.